Well, one of the biggest problems of female infertility is actually age, as fertility declines with increasing age. However, it is not just older women who may have a low ovarian reserve, and sometimes younger women can also have a lower ovarian reserve or one that is becoming depleted rapidly. So if you are a young woman and thinking of delaying motherhood, it's not a bad idea to get an idea of what your ovarian reserve is and what your options are for the future. If your ovarian reserve levels are low, you may want to have fertility preservation, whereby your eggs are vitrified so you can use them later in life and basically be your own egg donor for when you are older and ready to become a mother. Having a low ovarian reserve doesn't mean that you're not going to be able to have children, and this is where assisted reproduction treatments come in. We need to know the ovarian reserve so we can decide on the best course of treatment for the individual patient. For example, if we perform an antral follicle count and we see the value is good, there may be a good response to the ovarian stimulation for an IVF cycle. The more eggs we get, the more chances that we can produce a viable embryo that will lead to a future pregnancy. However, it isn't just the quantity of the eggs is important, but also the quality. And as a woman's age increases, the quality of her eggs also decreases due to things such as accumulated chromosomal abnormalities or genetic damage. So for older women with a lower ovarian reserve, they may need to think about egg donation in order to become a mother with an IVF procedure.